Okay, maybe we start. So hi everyone. My name is Hannah Diamond. I use she, her pronouns. I'm a policy advocate at Justice and Aging. And thanks so much for joining a conversation today about opportunities to advance equity in New Jersey and specifically to expand eligibility criteria for NJ FamilyCare programs that are impacting older adults and people with disabilities. So a little bit about us. Justice and Aging is a national organization that uses the power of law to fight senior poverty. We've been doing this for a little over 50 years, so since 1972, and we focus our efforts primarily on people who have been marginalized and excluded from justice, such as women, people of color, LGBTQ plus individuals, and people with limited English proficiency. I want to share our commitment to advancing equity. To achieve justice in aging, we must advance equity for low-income older adults and economic security, healthcare, housing, and elder justice initiatives. We must address the enduring harms and inequities caused by systemic racism and other forms of discrimination. And we must recruit, support, and retain a diverse staff and board. And with that, let's start our presentation, raising NJ FamilyCare eligibility criteria. So just some level setting here regarding what NJ FamilyCare is. It's New Jersey's Medicaid program. This program covers approximately 2.3 million low-income individuals and specifically 300,000 older adults and people with disabilities. So what is Medicaid? Medicaid is not Medicare. Medicaid is a joint federal and state program. It's for individuals who are low income. It's an entitlement program. Federal law and policies lay out the basic parameters of the program, but then states have significant flexibilities in the way in which they design and develop their programs. And one of those flexibilities is the eligibility criteria. So why is Medicaid so important for older adults and people with disabilities? Medicaid covers services that are not available through Medicare. Specifically, Medicaid is the primary payer of long-term services and supports. It's the primary payer for nursing facility services and home and community-based services. So I want to go over, and this is kind of a wonky presentation for this early in the morning on Friday, but I'm going to go over various eligibility criteria currently specific to older adults and people with disabilities through NJ FamilyCare. If it gets a little bit too wonky, please let me know and just chime in the chat or please interrupt me and I'm happy to answer any questions. So basically going back to the Affordable Care Act, the Affordable Care Act enabled states to expand Medicaid eligibility for those populations who are under the age of 65. So I'm going to refer to those populations as the Medicaid expansion population. So basically it enabled states to expand their income eligibility up to 138% of the federal poverty line. And it also removed asset restrictions for those populations. Unfortunately, the Affordable Care Act did not expand income and asset criteria for older adults and people with disabilities. So these populations are still subject to more stringent income criteria than other Medicaid populations, specifically the Medicaid expansion population. And so what are the implications here? Really, it results in a loss of coverage. So when an individual turns 65 or when they obtain Medicare coverage, despite having no other changes in income or assets, they may lose their Medicaid coverage. It forces populations into deep poverty by inhibiting their ability to save for an emergency. So the really limited asset criteria that we're about to talk about really don't allow someone to save for a leaking roof or a car repair, for example. These really strict eligibility criteria disproportionately punish older adults of color. Older adults of color are more likely to have cash savings than an exempt home for Medicaid eligibility. Home ownership is an exemption. So by having assets, cash assets, they are penalized. And also this policy or these policies, these strict eligibility thresholds reduce health and financial stability of older adults and people with disabilities. Many individuals put off getting needed services. In many ways, we can view Medicaid services as preventative. So by not accessing services, someone's health could decline. And as I already outlined, the financial implications of not being able to have a nest egg for an emergency. So I have two graphs that I'm going to share here that are just kind of highlighting where these coverage gaps are and the inequities across these various pathways that are impacting older adults and people with disabilities. So on this chart here, you can see these are various income limits for NJ FamilyCare programs. And where I have a red box on this chart, I'm showing you the gap in coverage between the Medicaid expansion population. So when an individual is under 65 and receiving Medicaid services, and then when someone is age 65 or when they are receiving Medicare. So the gap here between these two is about $500. So an individual, just because they turn 65, really may lose coverage because of this $500 gap. The same thing I want to show you here regarding the asset limits. The asset limits for these various pathways are kind of all over the place. There's a lack of continuity across NJ FamilyCare programs. Some have no asset thresholds and others have very minimal thresholds. So what I'm trying to show you here is that this is confusing for individuals as they're navigating these benefits, and also as they are kind of navigating the various programs, they're likely or could lose access to benefits because of the differing criteria. I will state that the JACK program that I have highlighted here has an asset threshold of $40,000. This is not an NJ FamilyCare program, but it's going to come up in the next slide and you're going to see why. We as advocates in the state are proposing two policy changes to address these inequities. The first would be that New Jersey should pursue legislative changes to increase the income eligibility thresholds for older adults and people with disabilities receiving NJ FamilyCare benefits to align with the Medicaid expansion population. So increase the income criteria to 138% of the federal poverty line. The second policy suggestion would be to pursue legislative changes to increase the asset limits for NJ FamilyCare programs impacting older adults and people with disabilities to $40,000 to align with the state's JACK program. So again, there aren't going to be these gaps in coverage. We're creating continuity of care across NJ FamilyCare and other state programs. What would the impact of these policy changes mean? These policy changes would reduce age and disability-based disparities. As we've noted, these populations are subject to more restrictive income and asset criteria than other Medicaid populations. These policy changes would promote health and financial stability. Individuals wouldn't have to be forced to go without care or impoverish themselves to pay for services. It would reduce the racial wealth gap by promoting housing stability for renters, particularly Black older adults. As we previously discussed, they're more likely to have cash savings than an exempt home. And it would also streamline administrative processes and lessen confusion amongst enrollees, making it easier for families to understand and navigate, and potentially reducing administrative burden for the state. So I want to talk about money because we're in a tight budget environment, and I often hear concerns about costs associated with these policies proposals. Advocates have really kind of coalesced around the asset proposal, so that's what I'm going to talk about. We actually think, based upon what we've seen in other states, I'm pulling from lessons learned in California specifically, that has first increased its asset threshold and then eliminated it entirely. Um, this this policy proposal does not have significant fiscal implications for the state. If anything, we think it would save the state money because it would reduce administrative burden for the state. This policy proposal in particular, when it comes to assets and increasing the asset thresholds, is more about keeping individuals who are eligible for benefits on benefits. It's reducing the loss of benefits through a process known as churn. So we're not really creating a new category of people who are going to be receiving benefits, but rather we're protecting those who are eligible for benefits from losing them. So again, we don't think that there is significant costs, and if anything, we think the state would save money here. And so the how, we want to leverage lessons learned from states that have successfully pursued these policy proposals, specifically California and New York. Both states use their state budget process to pursue these changes. It requires a statutory change and changes to the state's administrative code. And it also requires the state to submit a state plan amendment to the Centers for Medicare and Medicaid Services and for CMS, Centers for Medicare and Medicaid Services, to provide approval. So I have some resources here. Justice and Aging has produced two different fact sheets. The first focused on increasing income limits, the second focused on increasing asset limits. Within these policy documents, we're outlining the various NJ FamilyCare pathways specific to older adults and people with disabilities. We're describing the inequities surrounding the eligibility criteria. And we're really equipping, or we're trying to equip advocates on the ground with the language to talk about these policies, to talk about their impact, and then also a roadmap regarding how to move this forward in the budget process. And with that, my contact information is on the slide. I'd be happy to put it in the chat. I'm going to stop sharing my screen so I can see you all. And please let me know if there are any questions.
So these programs are only for people who are under age 65?
So the Medicaid expansion population that has the higher income criteria and has no asset restrictions, that population is under the age of 65. The changes that we are proposing would impact older adults, so over the age of 65, or those who also have Medicare. So people with disabilities that are receiving Medicare either through age or through disability.
Okay, so but these are only proposals. They're in process. They're not.
Yep, they're proposals. We would love to see, yes. So unfortunately, these policy proposals were not included in the governor's budget this year. There are groups, a small group of advocates that are brainstorming now and trying to think about ways that we can work with local representatives to try and uplift the importance of these policies, to try and see if we could get it included in this year's budget, or lay the foundation, the education foundation that's needed to drive it forward in years ahead. But we do really think that in New Jersey, given the kind of friendly connection that advocates have with the Medicaid agency, given that even this proposal could move forward in a tight budget cycle, given that New York has pursued these policy changes and New Jersey often likes to kind of mimic New York or even go beyond what New York has done, we think that there is real opportunity here a group of advocates sent a sign-on letter to the assistant commissioner going back in late fall, and there were 70 organizations that signed on to that sign-on letter in support of this proposal. So it does really seem that the advocacy community is interested in seeing this move forward.
Okay, thank you.
Mm-hmm.
Hi, Hannah. I had a question.
Yeah.
Thank you so much for, this insightful presentation. And since you're working specifically on this issue, I was just wondering if you had any information about working towards also including the undocumented older adult population, especially those who have worked and contributed to taxes. And I know in California, and correct me if I'm wrong, they were able to extend their healthcare to undocumented children. And then as a result, it became available to older adults. And I'm wondering if that might also be a possibility for New Jersey, if you knew anything about how that might be playing out or not playing out.
Yeah, Melanie, that's a really good question. That is not a part of this proposal in particular. And I know California has pursued, we're interested in not, Justice and Aging is interested in initiatives both for undocumented individuals and getting them coverage, but also regarding reentry. So individuals who are leaving incarceration and returning to the community, ways to enable access to Medicaid coverage. So I think that those are both populations that right now are really underserved and need focus. Melanie, I would have to get back to you. I think that there was a proposal in the state's 1115 waiver documents around that, and CMS did not approve it. Or they were working with CMS to try and receive approval. But I would have to double check that, Melanie. I think it's a good flag. And I'll put my email in the chat, and I'm happy to follow up with you offline.
Thank you. I appreciate it.
I don't know who was first. I saw Monica first. Okay.
Monica's first.
Hi, thank you. I'm wondering about other healthcare initiatives in the state where the FPL is much higher than 130% to catch those who are, would qualify for the Medicaid and Medicare, and whether or not that will sufficiently close the gap in those older seniors who need additional coverage options for surgery or for chronic illness disease, or just to kind of help them out. I know I'm just wondering if there's an alignment with covering more people, because I know the FPL is higher for different health initiatives for seniors.
Yeah. Monica, I think that's a really good point. Like in these policies, we have to be really careful that we're not actually perpetuating gaps. We're not making those coverage gaps worse. And so that's why when it came to the asset piece, we wanted to align with the JACC program, because that was an existing program in the state. It's kind of easy for people to understand why we were trying to move the threshold to match that, that program. Regarding the income piece, it's a little bit harder, frankly, because that's where the costs come into play. When you are really expanding income eligibility, you are making populations, many more individuals potentially eligible for benefits. And the reason that that is because people right now with the limited incomes cannot save. And so that's why when I'm saying that there aren't really significant fiscal implications for the state when we're making changes to the asset piece, it's because people's assets are so low anyways. When you start to expand the income eligibility piece, that's where we really start to see a lot more people becoming eligible, and there are cost implications associated with that. And so I hear your point. I would love these numbers to be higher. And I think that we can discuss that as an advocate community. But regarding feasibility right now, again, given kind of the budget environment that we have, just aligning the older adult and disabled population with the Medicaid expansion population is a good first step.
Thank you.
And I'm so sorry. Is it
Aisha.
Aisha. Thank you.
A part of my question was answered, but going back to the undocumented immigrants that are aging, uh, am I mistaken? Is New York now covering them? Maybe there are lessons we can learn from New York.
Yeah, that is not my area. I know a lot about Medicaid when it comes to home and community-based services and expanding eligibility criteria. The undocumented population is not my area of expertise, but I'm hearing that it is an interest from you all. And I think that we can look into that. And I know colleagues of mine at Justice and Aging are working on that area, so we can follow up with you. I hear you that it's an important policy to move forward, and we can see what we can do. Can I ask you all a question as advocates who are attending this conversation?
Of course.
I am assuming you were interested in this because this is a policy proposal that you want to see advance in the state. Have you, like, is this a priority for your organizations? Would you want to be involved in advocacy efforts to advance this? Maybe if I can see like a raise of hands.
Hey.
Hello.
Can I go ahead?
Yes, definitely. My name is Julian. I am from Newark, New Jersey. I work for New Community Extended Care, and I serve the elderly population. We are a nursing home. We are a skilled nursing facility, and that rings loud what you are saying, because our elderlies in Newark, New Jersey, a lot of them do not have access to Medicaid, and immediately they disqualify them, which is so unfair. And we, in New Community, we also serve a senior housing. We have about 6 or 7 buildings in different areas in New Jersey. So what you are saying rings loud and clear, and we need this. They need to increase the income for those elderly patients, elderly clients, seniors, in the entire New Jersey areas. So thank you for the work that you are doing.
Well, thank you, Julianne. And my contact information is in the chat. I'm happy to put it in there again. I'm coalescing a small group of advocates to brainstorm next steps to move this policy forward, specifically focusing on the asset threshold piece. Hopefully, we would love to see it in this year's budget. If you would like to be involved in those efforts, I encourage you to join me. Send me an email or put your email in the chat, and I will reach out to you directly. I just sent out a doodle poll to a few advocates this morning, and we can talk about next steps. Okay.
Yeah, I really joined because this issue affects me personally. So my mom has been disabled probably since her mid-30s with a psychiatric disability, and she's always had a gap in coverage because she's always been Medicare. And what they were able to do is use medically needy to fill in the gaps, but she's like, she has 6 months of coverage and 6 months not. It becomes very, confusing and cumbersome, and she has to wait on certain types of care. And we are talking a matter of $500 or less she's been disqualified for,
Right.
her whole, period. So I think that, this is just a personal experience I have, but I feel like this probably plays out over and over again for many families. So it is very hard. And, thankfully she is connected to an agency that does a lot of the medically needy process and, gets her connected, but it's not easy for people to, and she has a very limited income. So it's very hard to access the care she needs. And I'm just thinking about dental. That was a big issue. Took her a while to get into the clinic. Like, her treatment was really held up because we didn't have, the funds to be able to take care of that.
Right. Thank you for sharing that.
Mm-hmm.
And I think that those stories are what makes this policy real, and what stories like that help policymakers understand why we need to make these changes. Like, I can talk about the wonky way to go about these changes, and we need to make a statutory change, administrative code change, state plan amendment, but that's not what local representatives really want to hear. They really want to hear what is the impact and how is it going to really help New Jerseyans live a better quality of life and access the services that they need.
Aisha again.
I should, yeah.
So another way of advocacy is also, this is a huge equity issue because people who have access to legal services or legal methods to, protect their assets through trusts, etc., and everything, they're not affected as much by this. And like you said, people who have spouses, their houses are protected, their cars are protected versus it's a huge equity issue, and that is probably another angle for particularly certain districts that one can take advantage of in the advocacy efforts.
Aisha, that's a really good point. Specific to the asset piece, those who do have higher incomes can work with a lawyer to put their assets in a trust or other ways to avoid kind of what we're talking about now. So that's another example of the inequities here. And I think that's a really good point. And I just want to respond, Dorothy, I saw your comment in the chat about Kathy Rowe. Kathy and I are very well connected. She's already a part of this planning conversation, so she's there.
Excellent. I figured she would be. Thanks.
Rebecca?
Thank you for this. This has been really informative and great. I wanted to say that I work with the Inclusive Healthy Communities Grant Program, and part of what we try to do is a lot of the grantees really want to compensate the people with disabilities who are providing thought leadership on the programs. And this really becomes a problem because the asset limitation for people with disabilities is so low that a lot of times we can't compensate people for the work that they're doing. And it's really like a justice issue about that. And I think that what you're proposing would really give people more flexibility to be involved in these things and be adequately compensated for the immense value that they bring. That right now they're really just not benefiting from all of the work that they're doing. So thank you.
Great point, Rebecca. Thank you for sharing. Thank you all for there's so many people who put their contact information in the chat, and I will reach out to you and share a doodle poll later this afternoon with opportunities for us to meet. So to give you an example, specific to California, California first increased its asset thresholds to 138,000, and then they eliminated it entirely this year. Specific to New York, I always forget, their calculation is a little bit interesting. Okay, it's 150% of the Medicaid income limit. It's about, I think, $35,000, $38,000 that they increased it to. So those are just two examples. Thank you all so much for joining. I really appreciate your time.
Thank you so much.